Often folks come to me and they have a certain set of symptoms. They've gone to their regular doctor, their family practice doctor. They run their traditional labs and they're told, hey, everything looks good. They think that everything is fine lab wise, but they know that they don't feel well. When I take a deep dive and look at their lab work and we run some other tests, we find that things aren't as great as what they thought. There's a difference between normal range and what I like to call that sweet spot, the optimal range, where things are in the functioning range. The other part of it is that sometimes, because of what's going on inside the body, our levels in our bloodstream may be in normal range, or even they could be in optimal range. But if things aren't going well inside the cells, things aren't the way that they seem. Functional medicine is different than conventional. I was trained as a conventional family nurse practitioner, and I was taught, here's what we're looking at, and here's the certain ranges. And here's what we do. We give it a name, we call it a disease or give a diagnosis. Oftentimes, the treatment plan is just a medication. Think of functional medicine, all disease and disease processes as a tree. In Western conventional medicine, everything above the ground, all those branches and the leaves that you see, that's all of the symptoms that you're having. That's all the names of what's going on, the diagnoses that or disease names that you've been told. What is going on below in the root system, that's why the tree is grown, right? In functional medicine, we're looking at the why. If I step on a nail, my foot hurts. The why is because I got a nail stuck in my foot. In terms of something like thyroid disease, if I'm experiencing symptoms, brain fog, fatigue, cold, inability to lose weight, thinning hair, dry nails, dry skin, I want to know what went on down here that's causing all these symptoms. Sometimes the why isn't as apparent when we look at traditional blood work. When we look at traditional blood work, we're looking at the levels in the bloodstream of certain hormones, which are messengers. Sometimes those messengers can't get into a cell that doesn't work the right way. Our blood levels may be fine, but really what's going on is deeper than that, and that's dysfunction in the cells in our body. I think the medical system that we know today has been growing over the last 100 years. The way medicine was practiced before the turn of the 20th century was way different than the way it's practiced now. We came up with ways to create things to protect our country, things to protect other countries. And in the process of doing that, things change in the way we take an approach to a lot of different things. We've created more chemicals than what we did. We figured out that we could isolate it with the knowledge, the growth of information with the war. We learned how to develop different things. We learned how to isolate a certain chemical and we turned that into a medicine. Part of that came out of the development of antibiotics, where we were able to isolate certain things to treat infections, and that grew into what became now pharmaceuticals. We learned different pathways. We were able to study the body in a different way and take a look at the different chemical things that happen in the body as the information age has grown. Medicine grew to be where we are focusing on the changes in the pathways and how we can stop those changes from happening. Whereas before we used to take a much more holistic approach, and now functional medicine brings it all around. I'm also a traditional naturopath. That means I'm also looking at natural ways that we can do things instead of single chemicals to treat single symptoms. I think that it's been the growth of knowledge where the focus has become more siloed. The medical training model has become to focus on this single treatment of symptoms and use these chemicals, i.e. prescription medications. And that's the way most of our medical practitioners are taught. We keep birthing new generations after generations, doctors who are trained to practice that type of medicine.